Antihypertensive drugs. Diuretics. Increase urine production, reduce fluid volume, and lower blood pressure. Classes 1. Thiazide diuretics. 2. Loop diuretics. 3. Potassium-sparing diuretics. 4. Carbonic anhydrase inhibitors. 5. Osmotic diuretics. Examples: hydrochlorothiazide, furosemide, spironolactone, acetazolamide, mannitol. Mechanism of action: increase urine output, reduce sodium, water retention, lower blood volume. Beta blockers block adrenaline's effects on beta receptors, reducing heart rate and blood pressure. 1. Non-selective beta blockers. 2. Selective beta-1 blockers. 3. Beta blockers. Examples: propranolol, atenolol, acebutolol. Mode of action: block beta receptors, reduce heart rate, contractility, and blood pressure. ACE inhibitors inhibit the enzyme that converts angiotensin I to angiotensin II, lowering blood pressure. Classes 1. Short-acting ACE inhibitors. 2. Long-acting ACE inhibitors, e.g., captopril, lisinopril. MOIA. Block angiotensin-converting enzyme, reduce angiotensin II production, lower blood pressure. Angiotensin II receptor blockers. Block angiotensin II receptors to prevent vasoconstriction and reduce blood pressure. 1. Selective ARBs, e.g., losartan, valsartan. MOA. Block angiotensin II receptors, reduce vasoconstriction, lower blood pressure. Calcium channel blockers. Block calcium entry into heart and blood vessel cells, causing vasodilation and lowering blood pressure. Classes 1. Dihydropyridines. 2. Non-dihydropyridines, e.g., amlodipine, verapamil. MOA. Block calcium channels in smooth muscle and cardiac cells, causing vasodilation and reduced heart rate. Alpha blockers. Block alpha adrenergic receptors, causing vasodilation and lowering blood pressure. Classes 1. Alpha 1 blockers. 2. Alpha 2 blockers, e.g., doxazosine, clonidine. MOA. Block alpha receptors, cause vasodilation, reduce sympathetic nervous system activity, lower blood pressure. Alpha 2 agonists stimulate ALPHA2 adrenergic receptors in the brain, reducing sympathetic nervous system activity. 1. Centrally acting ALPHA2 agonists, e.g., clonidine, methyldopa. MOA. Decrease norepinephrine release, lower heart rate and blood pressure. Direct vasodilators. Relax smooth muscle in blood vessels, causing vasodilation and lowering blood pressure. Classes 1. Arterial vasodilators. 2. Venous vasodilators, e.g., hydralazine, nitroglycerin. MOA. Directly relax smooth muscle in blood vessels, reducing vascular resistance and heart workload. Renin inhibitors inhibit renin, which reduces the production of angiotensin II, lowering blood pressure. 1. Direct renin inhibitors, e.g., aliskiren. MOA. Inhibit renin, decrease angiotensin II production, lower blood pressure. Centrally acting antihypertensives act on the central nervous system to reduce sympathetic outflow, lowering blood pressure. Classes 1. Alpha 2 agonists. 2. Imidazolines receptor agonists, e.g., clonidine, moxonidine. MOA. Stimulate central receptors, Reduce sympathetic activity, lower blood pressure.